how do we discuss a delivery plan with a patient?
Well, delivery plan with the patient is actually discussed along with her husband, or if sometimes their mother are also available. Uh, as early as you said, the patient needs to be mentally, physically be prepared for it. We, with our prenatal classes or exercise, our therapists generally have already given a foundation about what to expect and how to go about a labor. As a clinician, at around 36-37 weeks, if the patient doesn't have any complications or any pre-existing complication like hypertension or diabetes or any like less fluid around the baby, in that case we can allow them to wait till the given date of delivery and then take a call when to induce labor. So when we talk about delivery, we first tell them what is the stages of labor, how does it appear, and how long will the labor pain last for. Because if it's a first pregnancy or first delivery, the labor can be as long as 12 hours also, because the dilatation of the cervix is pretty slower in first pregnancy. Then what are the complications we can anticipate during the labor, like bleeding or fetal distress or intolerable pain. These are certain anticipated complications or problems which can happen. We encourage for painless delivery, where we do epidural anesthesia. So we do educate the mother and the husband about the procedure, and we put them across to the anesthetist, who again tells them about the pros and cons of this painless method of normal delivery. Then there are certain times where we may have to even do a emergency cesarean. So as again I said, it's a teamwork. We are more prepared for these complications than any other place. Having told this, so when do you induce patient for delivery?
The total duration of pregnancy is 40 weeks. So in a low risk patient where the fluid levels are normal and the baby's growth has been normal up to 40 weeks, we wait for spontaneous pains to come till your due date. Supposing you have not got labor pains till then we advise something called induction of labor. Induction of labor is a simple procedure where it's not a procedure, it is that we use different types of medicines to induce pains. One is a gel which is put into the cervix to induce contractions or labor pains. Another would be a pessary which we insert into the vagina. So we decide the method based on the findings that when we do an internal examination. Based on these findings, we decide which medicine should be used to induce labor pains. So normally we induce labor pains and wait for you to progress or get labor pains, wait for a total duration of 12 hours and do a reassessment and see how favorable you've been or how much is the progress, and then take it forward from there, like how it happens in any normal case. What you need to know during induction is that you will start getting pains, and at any point of time, as we said, we encourage painless delivery. If you're not able to bear the pain, you can always opt for epidural analgesia or even IV medications to reduce the pain. A lot of patients opt for cesarean section because they cannot bear the pain. So this is bypassed by using epidural analgesia.
To add to this, induction can also be considered in some pregnancies where the fluid is less. Suppose we detect that the fluid around the baby is less around 35-36 weeks. We can try to we give certain medicines to make the baby's lung mature faster, like steroids, and monitor the pregnancy. And if you think that the fluid is going below the level what is comfortable enough, then we can induce the labor as early as 37 and 38 weeks also. And in other situations, like if the patient is diabetic and on insulin, we generally tend to induce them somewhere around 37-38 weeks of gestation. If she is diabetic and not on insulin, then we generally induce them at 39 weeks of gestation. Some patient will develop what is called as pregnancy-induced hypertension or preeclampsia. In that case, if it is pregnancy-induced hypertension and it is under control, we'll try to prolong the pregnancy till 37 weeks, and if she reaches 37 weeks, we induce labor. And if patient develops preeclampsia and it is less than 36 weeks, then it becomes difficult for us to decide for a normal, because sometimes it puts lots of pressure on the baby while delivering. So baby may end up having fetal distress and we'll end up having a cesarean section. So that may require elective cesarean section. There are other certain conditions where we may have to preemptively induce labor, which will be discussed again with the patient. To add to this, there is a misconception that induction of labor invariably will lead to cesarean section. No, we have seen in our practice that almost 70 to 75% of the induction of labor has normal delivery. The only mantra or dictum is we have to wait patiently. Another misconception is induction of labor is very painful. Now, what happens when it is a normal labor pain? It sets in. It sets in very slowly, and you try to gradually adjust to the pain. But in induction of labor, the pain starts a little bit very suddenly. So you tend to feel the pain a bit more strongly. But then the intensity is not anything different from what happens in a normal labor pain starting or to that of a induction of labor pain.